I'm Sara.
I'm Kristen.
I'm Megan.
And today we will be talking about psychedelics. So before we get started, I would like to take a poll. When we say the word psychedelics, what's the first thing you think of? Any words that come to mind?
Mushrooms.
Music
Trip.
festivals.
Festivals. Cool.
Expansion.
Ooh, okay, this is a good little word math. So we're going to talk a little bit more today about what psychedelics are, the mechanism, how they were developed, a little bit about the history, and then the benefits of it, side effects, and where the literature is at right now. Cool. Yeah, that's a little bit more about that. Okay, we can go to the next slide. So first for history. So actually psychedelics have been around, there's evidence since ancient times. So it's used commonly in indigenous medicinal traditions. One that I found is called Soma, which is also Amanita muscaria, which is common in Hinduism. And then there's also evidence of the ancient Greeks using this ergot fungus. And that's been around for a while, but there was kind of this revival in 1938 when Albert Hofmann, he first synthesized lysergic acid diethylamide, which is, we commonly know that as LSD. So that kind of sprung this like cultural and scientific movement in the 1950s to the 1960s, where we were starting to explore more of the psychedelics, and actually the government was involved in like promoting these studies because it was almost seen as the wonder drug, especially with LSD. It was like this magic drug that could do so many things and affect the brain in ways we hadn't really seen before. Sorry, the formatting got all messed up. But so we're moving into the modern psychedelic research, and then 1970s to 1980s, the government did a full 180 because it was considered counterculture after a while when some of the more negative effects of psychedelics being used in the wrong context came about, and so they actually put some strict interventions to halt a lot of the research that was going on. So research they once supported, they were now banning. And then that happened for a while. Now in the present, it's starting to make a little bit of a comeback, and there's a lot more support in research institutions, both nonprofit and for-profit institutions are supporting the research, and as well as private practice sites, and it's being looked at currently with a lot of psychiatric conditions, looking at PTSD, alcoholism, social anxiety, depression, and addiction, and what potential it has there. So, as we said, we were looking at the modern use of psychedelics plants by non-Western cultures, so it's still something that started years and years ago and is still being used today. But one that's really common that you might have heard of is ayahuasca, and that contains psychedelic DMT, and so that's commonly used by people in the Amazon. Another is the peyote cactus, which contains mescaline, and that's used often in many rituals by North American Indians. And then also this one sounds a little more familiar, magic mushrooms, and that contains psilocybin, and that's used worldwide. And here's a picture of a shaman who was just a respecter elder of a tribe who is considered both a doctor and a priest, and he's using plants and other non-drug techniques in the ceremonial. So it's interesting because a lot of psychedelics in these cultures are used in the ceremonial practices. So you take it, and then there's also some drumming, there's chanting, and the goal is to induce this dreamlike state and connect the user to the spiritual world. Next slide. So how does it work? So I like this slide because I think it has a lot of familiar receptors that we learned in school earlier in our biochemistry classes, but looking at on the edges are a lot of different psychedelics. So first we have psilocybin, which is found to decrease depression, and that works on the 5-HT2A, 1A, and 2C receptors, which are all the serotonin receptors, as an agonist. And then at the top we have LSD, again some familiar receptors, the serotonin receptors, as well as D1, D2, D4, the dopamine receptors, and has both the partial agonist and an agonist mechanism. And we can see that that is associated with decreased depression, increased associative learning, increased aggression, and decreased anxiety. So there's kind of like a both positive and negative symptoms associated with that. We have ketamine, which is becoming more and more popular as a psychedelic these days. That's shown to decrease depression, but also at the same time increased neuroplasticity as well as increased enduring spine formation. So it's interesting to see the long-term potential impact of these drugs on our brain chemistry. And then we have last MDMA, which increases sociability, decreased PTSD, decreased alcohol use disorder, and decreased social anxiety, and that one works on the serotonin, and then the dopamine and the norepinephrine receptors, and is also controlling a lot of these hormones that we've talked about: cortisol, vasopressin, and oxytocin. So many different mechanisms of all of these different psychedelics. And a little bit about the development. So first we have LSD. So as I mentioned before, the government was initially in support. They actually had 130 grants that were funding the study of LSD when it was first considered this magic drug. And then in 1967, that's when it was banned, and so they did that 180. There's a lot of hesitancy because they found that people who were more prone to schizophrenia, if they did take LSD, that would throw them into a psychotic episode, and so there was like a lot of hesitancy and fear associated with it. But now it's considered a Schedule I drug, or at the time it was considered a Schedule I drug, so it was like not accepted in medical use and significant potential to cause harm or dependence. There's still that remaining hesitancy around it. Looking at MDMA, it was previously used in psychotherapy to counsel on empathy, which I thought was really interesting. And then at some point, the name changed to ecstasy, and then that made it associated with like a party drug. And so just simply a name change completely changed how it was looked at in culture, because it was associated with the rave recreational scene, and it was banned soon after that. But now the FDA has approved it for therapeutic research, specifically in alcoholism and PTSD. And then finally, we have ketamine. So we recognize that from our anesthesia rotations, it's historically been used for pediatric anesthesia pretty typically. And recently, actually, research has been done looking at single-dose IV ketamine for treatment-resistant depression, because it's showing some benefits that current drugs that we have on the market are unable to have. And then they also have this S-ketamine version, which is intranasal, and that's currently being developed commercially to treat depression. Oh, and then another interesting aspect of it is the public perception and how that's changed over time. We've touched on that a little bit. But as I said, in the 60s to 70s, they had that counterculture movement, which was really pro-psychedelics. And then in the 80s, turned around and it was the anti-drug movement. And then in the 1971, the U.S. Controlled Substances Act froze the strictures on certain hallucinogens. And so now a lot of the current research on this is being done by philanthropically funded initiatives, but some of the most major research institutions in the country have really robust research projects going on these right now, including Yale, Johns Hopkins, UCSD, and Berkeley. And most recently in January 2022, the NIH hosted a free virtual workshop on psychedelics and therapeutics with like thousands of attendees, and so I think this is noting a shift in the culture towards psychedelics at this time. And there's also another thing to consider is the political and economic point of view of psychedelics. So the market by 2027 will be worth $7 billion just because of all of the potential and a lot of the psychiatric conditions that we've talked about today. And by January 2022, there were 50 publicly traded companies in this space, so it's interesting to see the connection between business and marketing and this medicine place. And there were 3 companies in that space valued over $1 billion. And then finally, on the political side, there have been some bills introduced at the state level to legalize and decriminalize medical psilocybin in Washington, California, Pennsylvania, and Maine. So there is this movement starting at the political level.
So we're going to focus mostly on psilocybin research because that's one of the really big areas right now, and we could spend hours talking about all the different psychedelics, but we'll focus in a little bit more on the medical benefits of psilocybin. So like Kristen said, it can be used in so many different psychiatric conditions, and there's very significant evidence-based research showing that it does work. So this study, like Kristen said, Johns Hopkins is one of the main institutions that's doing a lot of this research, and they have a very robust psilocybin research center, and that's where I found a lot of these studies. So this is looking specifically at tobacco addiction. So they took a group of smokers who had a very significant smoking history, around 30 years. They had tried to quit, I think on average of 7 times before, and they were smoking around 20 cigarettes a day. And they did about a 15-week study of giving them psilocybin, and these are the results of their smoking after the 15 weeks on psilocybin. So the left graph, that's all of the participants in the study, and then this right graph is participants who, after the 15 weeks, still had a positive, or still were smoking. But you can see that's a really significant decrease in the number of cigarettes they were smoking each day. So really beneficial there, and it showed that psilocybin was better at decreasing smoking than the other methods that we're typically prescribing to patients now. So that's a really big finding.
Is the one on the left,
Mhm.
on left, that's post-treatment?
Post-treatment.
Oh,
so
okay.
the intake, that was before they were smoking between 15 to 20 cigarettes a day, and then 6 months after the treatment, that's how many cigarettes
Oh, I see.
those patients were smoking a day.
And then the second graph is,
People who still over 7 days, I think they were using a 7-day period to say how many cigarettes are you still smoking. This group on the left, they were still testing positive for smoking, and still a decrease in the number of cigarettes they were smoking each day. So still an improvement. Then they also did another study looking at existential anxiety and depression for people with life-threatening cancer, and I just thought these results were really cool. So psilocybin decreased clinician and patient rated depressed mood, anxiety, and death anxiety, and increased quality of life, life meaning, and optimism. And what really stuck out to me was that 2/3 of the patients in this study reported this experience of taking psilocybin as one of the top 5 most meaningful experiences in their lives. So that's really powerful, especially for people going through something as serious as maybe a terminal cancer diagnosis. And then this kind of connects in with the spirituality related to psychedelics too. So 70% reported it as one of the top 5 most spiritually significant lifetime events that they had. So really powerful stats that we're seeing here.
Okay, so these next 2 studies are looking specifically at psilocybin and depression. And so in this first study over here, they used 12 patients with this treatment-resistant major depressive disorder. They received 2 doses of the psilocybin, a lower dose and a high dose. Lower dose and a higher dose. And then it's also worth noting that this was given in a supportive setting, so these patients were still receiving counseling, psychiatric services, or psychological services, I guess. And their depression symptoms were assessed at between 1 week and 3 months after the treatment using the QID scale. And so the results showed that relative to baseline, the symptoms were markedly reduced 1 week after, and then that shows the mean QID difference, as well as 3 months after, and specifically after the high dose as well. And so essentially this first study here, which was done in 2016, showed the safety and efficacy of psilocybin for the treatment of major depressive disorder. And then the second study over here kind of went on to build on this first study to show that the psilocybin assisted therapy was efficacious in producing large, rapid, and sustained antidepressant effects in patients with major depressive disorder. Because in this study over here, again, they had 2 sessions, with the first session giving 20 milligrams per 70 kilograms that a person weighed, the second session giving 30 milligrams. And then some patients were treated essentially immediately, and some patients were treated after an 8-week delay. So I was kind of reading this paper, it wasn't super clear, I guess how long it had been determined a person had depression, but essentially bottom line was that the people who got the treatment faster had better results at the end of the study, kind of showing that not only is it important, not only is this an effective treatment or adjunct treatment for depression, because like I said, these patients were still receiving counseling and therapy, but it was even more impactful if you treated patients like as soon as possible. And then this is psychedelics and PTSD. So this study was looking at MDMA-assisted psychotherapy for the treatment of PTSD, and as you probably have guessed, this had good results as well. So this study involves giving active doses of MDMA between 70 and 125 milligrams to 72 people, or a placebo dose, which is significant as well because the other two depression studies didn't really have like a good control group, and so this study did. And then they were administered to individuals with PTSD, and then as well the individuals were still doing psychotherapy sessions. So also another common theme is that all of these studies are still implementing, they're using these drugs as an adjunct to therapy. They're not like replacing psychotherapy with them. But the results were significant. The active group had significantly greater reduction in their CAPS-4 total scores from baseline. The group that was treated had less people at the end of the study who were still meeting criteria for PTSD. And as well, they also showed greater improvement in depression, like symptoms of depression, which we could have assumed was going to happen based off of the previous studies that we discussed. Essentially just showing that MDMA is also a safe and effective adjunct treatment for the treatment of PTSD. And then for this study was an interesting one that I came across. So it was looking at psychedelics in racial trauma. So I was kind of like reading a paper about how a lot of psychedelics nowadays are kind of like, there's been like a whitewashing of psychedelics because of the fact that like Kristen talked about, there's a lot of history behind the use of psychedelics, and there's a lot of like indigenous groups of people who use them for like more religious purposes, and nowadays it kind of tends to be like white hippies, like white like American hippies that are the ones that are like wanting to try this out, and I guess that's kind of like the new stereotype that's come about. And so that's what like this paper has talked about, and how essentially we can like make sure that in the research that we're doing that we're still kind of like just like respecting the tradition, like respecting like where this came from essentially, and making sure that we're still like putting effort into like studying the effects specifically on people of color and like indigenous groups as well, and not just like wealthy, depressed like white people. So this study showed that it was just a cross-sectional online survey of 313 Black, Indigenous, and people of color in North America. And the findings suggest that the naturalistic use of classic psychedelics, or MDMA, is associated with significant reductions in traumatic stress, depression, and anxiety symptoms related to experiences of racism. So this is the only paper like this that I found, but I guess we can touch on later, like going forward, kind of like how there is a need to make sure that we're including like indigenous groups and like people of color in the research that we do. So some dangers and adverse effects. This is like making me laugh already, because every time when I try to Google the dangers of psychedelics, there were a lot of things that said like, oh, no side effects, like nothing to worry about. And then you would get to pages about people being like, oh my gosh, I took like 200 milligrams and I like jumped off my roof or something, like crazy things, like absurd stories. So essentially, I guess what it seems like, so I guess first of all, going in terms of the actual like documented side effects, because it's not realistic to say really that anything has absolutely no side effects. So we can just like get that straight first of all. In the first depression study that I talked about, the patients who were given 25 milligrams, so there were 12 of them total, and all 12 of them reported having transient anxiety. 9 of them reported having transient confusion, 4 reported transient nausea, and then 4 reported transient headaches. And I know that from like when I was trying to look up side effects, like I said, like a lot of the like reported side effects were just coming from like self-reports of people saying like this happened to me, or I did this when I took this much. And what it seemed like essentially was that like obviously higher amounts there's like a greater likelihood of side effects. And nausea was something that I kept seeing across the board. And I know also just from like hearing about like people who do go on these like peyote or like ayahuasca journeys, because that's something that you can do. Like you can pay to like for a shaman to like lead you on this journey, and it's very popular in other countries. I know that like a lot of people. When I was recently in Peru, I like met a lot of people who traveled there for that purpose. But anyway, like nausea is the biggest thing that a lot of people talk about, and they say like that you are just like expelling the bad spirits. Like it kind of is like part of the process from what I have heard from other people's experiences. So, and then in addition to that, like I had said, a lot of the things that I read online, like the more, I guess like the worst outcomes all seem to be from really like the impaired judgment that you get, because all of these side effects here say transient. Like there haven't been any documented long-term, like I read that there's no evidence that these are addictive, or that there's no clear evidence that these can have like long-term effects after the drug wears off. But I also was reading that some people had like very impaired judgment and did things that got them like very injured, or like some people had passed away from doing things that they like probably weren't realizing that they were doing in the moment.
Yeah, and I think going off of what Megan said, it's important to note that a lot of those stories of the impaired judgment or the dangerous events occurring due to use of psychedelics are from people taking them in an unregulated recreational setting. Those events weren't happening in any of the studies that we were looking at where it was regulated. There was a medical professional overseeing the use of these. So I think that's why there's a lot of negative connotations with psychedelics, because people are thinking about it in the recreational sense and not necessarily all of the medicinal benefits that they have.
Yeah, like there's a TikTok that we talked about adding on, because this man, I was just looking up like negative effects of psychedelics, and this man was like, oh, one time took 500 milligrams, which again, not the 25 or the 10 that they're being given in these studies. And he was like, and yeah, I cut off my tongue, like it had to go.
He thought he was going to like bleed out from his tongue, so his girlfriend cut off his tongue.
Oh yeah.
And then said it came back.
So, yeah, apparently. So yeah, that's what I'm talking about. I'm saying severely impaired judgment can occur, but more so with the large quantities that people take recreationally.
And another thing we came across when we were researching is, like I mentioned, Johns Hopkins is doing a lot of psychedelic research, and in 2020 they were awarded a grant from the NIH to explore the impacts of psilocybin on tobacco addiction, and this was really monumental because this was the first like federal grant given in 50 years for psychedelic research. So the times are changing, and this is starting to become more of a national priority too, to see how we can use these to benefit people.
Yeah, so just to close this off, so it seems like psychedelics have a lot of potential. There's a lot of great like, preliminary research at this point. However, something worth noting is that a lot of the studies that we looked at did have a pretty small number of participants. And so we need more studies, we need more participants to be able to say that we can really generalize these results. And then in addition to, like I touched on earlier, like we need to make sure that we're including like not just like wealthy white depressed people, but everyone. And we also need more long-term studies as well, because a lot of these studies have been shown, like we said, like basically they had only followed the participants over the course of a few months, maybe up to 6 months. However, it would be, I think, really impactful to see where these participants are in like 5 years from now, to know if these impacts are like lifelong versus just like short term.